Hello and welcome to Newsmax TV. I'm John Bachman. Joining me right now is Congressman Steve Scalise. He's in Washington, D.C., and he's the chairman of the Republican Study Committee, which has just released a new plan aimed at replacing Obamacare. Congressman, thanks for being with us.
Hey, great to be with you.
All right, so the plan that the RSC, the Republican Study Committee's healthcare working group, has just announced is called the American Healthcare Reform Act. This plan is supposed to encourage more market-based solutions, increase competition, and focus healthcare back on the patient. Just this week, the president said, quote, "I'm willing, or more than willing, to work with Republicans where they've got specific suggestions that they can show will make our healthcare system better." Now that the president has some specifics, do you expect him to work with you guys at all on this?
Well, you know, if you go back to the debate on Obamacare in 2009, the president made similar promises when he was barnstorming around the country. He said, "I'll sit down with any Republican Congress and talk about any idea they had." There were at least 6 of us in Congress who took him up on that offer and actually sent a letter and called the White House and said, "We do have a number of ideas that will actually reform and fix health care, and we want to sit down with the president." Not one of us got a call back. So the president, unfortunately, was not sincere, didn't back up his words back then. I would hope maybe he's getting a new attitude now that so many Americans, including a lot of the supporters of his law, some of the union leaders, are now saying this law of Obamacare is going to be devastating and they want it repealed. Warren Buffett just came out and pointed out how devastating Obamacare is going to be. So you're seeing so many people realize how bad the law is that maybe now he is willing to sit down with us. And we laid out, I think, a very strong, bold vision of how you can actually lower costs in healthcare and increase access without these government mandates and taxes that are making healthcare unaffordable and unworkable for people across the country.
Yeah, well, things certainly have changed since the president was first elected, and the law is increasingly less popular with the American people. And of course, I know you guys have been working very hard on this plan for months, but still we are less than 2 weeks away from the implementation of Obamacare. Why wasn't a plan similar to this one introduced a year ago or 2 years ago?
I can't speak for previous Congresses. When I became chairman of RSC in January, this is something that I wanted to make a top initiative. I think last year there was was more of a deference to the Republican nominee, and Mitt Romney was the nominee, and I guess there was a feeling by some in our leadership that the nominee would be the one to lead on healthcare alternatives. But this is a new day where we're beyond that election. We felt it was important to put an alternative out there because we're strongly fighting for repeal of Obamacare, but I think replacing it with market-based reforms is something that we equally want to talk about, and that's what this bill reflects.
Now, a few hours before you guys announced your plan, the House leadership announced a different plan, not specifically a health care plan, but one that would avoid a government shutdown and defund Obamacare for a year. This would be the continuing resolution. But up until now, there has been a sharp divide in the House GOP caucus on the best way to defeat the president's signature health care legislation. What's your take on the Speaker's announcement today, and is any of this a signal that the GOP is finally coalescing around one plan to move forward on health care reform?
Yeah, I applaud today's announcement. In fact, myself and a number of other members of RSC have been pushing and meeting with our leadership for weeks now, asking them for this kind of approach where we would have a CR to fund government, which we want to do, but also to have a delay and defund of Obamacare at the same time. And so this bill that the Speaker's bringing forward is something that I support and a lot of our members do, because it actually continues to keep this battle going, and it's something that we've been asking for a long time. So our leadership has listened to our membership, and I think you're going to see a united Republican conference in the next 2 days when we bring this bill to the floor.
And that's something we have not seen yet really up until this point. And through much of this debate, we've heard so much from both sides of the aisle really about the need to reduce the cost of health insurance premiums, but a little bit less about the critical need to address the actual cost of things like prescription drugs and medical devices. Americans pay so much more than other nations around the world for simple things like cholesterol-lowering medications. What in your plan specifically addresses these costs, not just the cost of health insurance premiums?
Right. When you look at the CR and what we're trying to do on defund and delay, this is just one round in what is a long fight. If you look at our bill that we filed in RSC today, the bill starts off by repealing Obamacare. And of course, that includes some of the devastating taxes like the medical device tax. One of the things that's driving up the cost of medical devices right now, as well as driving tens of thousands of jobs out of our country, is the medical device tax in Obamacare. Again, one of these many perverse incentives to ship jobs overseas that is in Obamacare. There are perverse incentives in Obamacare that encourage employers to reduce their workforce below 50 employees and to reduce workers' hours below 30 hours. That's something that the unions, James Hoffa wrote a letter just recently pointing out how those provisions of Obamacare are devastating middle-class families in the 40-hour work week. So there's so many things in Obamacare that are creating big, big problems in our economy. By repealing it in our bill, what we do, and moving forward with real market-based reforms, we can not only stop the problems that are in Obamacare, but also start to lower costs and address some of the other problems.
You know, also in America, we spend more tax money per capita on health care than countries like Canada and the UK, which do have single-payer health care systems, quote-unquote free health care, as it's called sometimes. What specifically in the plan tackles that problem, the amount of tax revenue that we're currently paying, even before the full implementation of Obamacare, the tax money that the Americans are paying for health care in this country already?
Right. There are a number of things that we do in our bill, and one of the problems you're paying so much in tax and after-tax dollars in healthcare is because there's no real competition. In each state, most consumers are limited to maybe 2 or 3 choices. And yet for most products, you can go online and find 50, 100 or more different options, and you can pick which one is best for your family, which one is the best cost and the best benefits. You can't do that in healthcare. So in our bill, we break those barriers down. We actually equalize tax treatment so that an individual right now, if they want to buy healthcare on their own, they have to use it after tax dollars, where your company can actually deduct those expenses. In our bill, we equalize that, so not only can companies deduct their tax, their healthcare expenses, but individuals would also be able to deduct their healthcare expenses. We allow people to buy across state lines. So if you find a better plan for your family that's in a different state, we break those barriers down so you can actually go buy that plan that might be better for your family and cheaper. We allow people that are in different organizations to pool together through association health plans so that they can get the buying power of large corporations. So all of these things that are in our bill actually increase competition, lower costs in healthcare, and those were the big problems that were keeping a lot of people from getting healthcare, but also forcing so many people to spend so many of their tax dollars on medical expenses that were going up too high. And one other thing I want to throw in, medical liability reform that we do is so critical to this. Many doctors will tell you about a third of all the tests they run have nothing to do with your health care. The tests are run because they're afraid of frivolous lawsuits. It dramatically increases the cost of health care. We tackle that as well by putting in place common sense medical malpractice reform.
And about that last point, I want to talk about Texas, because Texas has one of the toughest. They've been pretty proactive in terms of tort reform, and that last thing you talked about. And after which they passed this law, there has been research that's shown there really hasn't been that much of a difference in the cost of health care, even with tort reform in a state like Texas. Do you care to address that?
It's brought in a lot more doctors. One of the things you see is doctors in states without good medical liability reform are leaving their states and going to states like Texas where they have really good protections for both patients and doctors. Maybe the trial lawyers aren't as crazy about that, but when you see doctors literally fleeing states because of these threats of frivolous lawsuits, because they can't practice medicine in a responsible way, and moving to states that have good medical liability reform, it shows you that the access problem is just as big as the cost problem. So by us actually working on things that create competition and allowing consumers the ability to shop around, both buying across state lines, working within their trade groups or their chambers of commerce to buy better plans than their business, to be able to deduct their own expenses, instead of just being forced to go through their employer health plan. All of these things will drive down costs and create real competition that doesn't exist today.
Well, I know another huge difference between the plan you guys presented today and Obamacare is the number of pages. The Republican Study Committee's plan has, I think, a couple hundred pages. Obamacare, of course, is a couple thousand. And I think I also heard Congressman Poe say today that he welcomes input from Democrats. Is there anything in those 2,000 pages of Obamacare, which was only supported by Democrats, that would dovetail with the new plan? I know you guys are seeking some Democratic input on this, but anything in Obamacare that you would like to see in the RSC's plan as well?
I think the repeal of Obamacare is the one thing we want to see. And if you look at Obamacare, the problem is it was rooted in a completely different approach than we're taking. It's 180 degrees apart from where we are. It's much more focused on a government-run system. In Obamacare, you've got thousands of pages of mandates where bureaucrats, like IRS agents, can come between you and your doctor. That's not something American families want. It's surely not something we as Republicans want. And frankly, there are a lot of Democrats that want it either. There are a lot of Democrats that had voted with us on repeal of Obamacare. So I think there's bipartisan support to take a very different approach. And that's what our bill represents. It's a bill, as Dr. Rowe, the chairman of the RSC's healthcare working group that helped put this together, said, we want to reach out to anybody that wants to work with us. And if they've got good ideas, we're happy to bring those bills and those good ideas into our bill. If it's a bad idea, obviously we have a bad bill right now in Obamacare. So there are a lot of good ideas. They're not just Republican or Democrat ideas. And if you look at the things that are in our bill, like buying across state lines, like tax equalization so that families are treated just as good as businesses are. Those are things that all Americans want to see in healthcare reform. None of that was in President Obama's law. It is in ours.
All right, now I want to correct myself. I said Congressman Poe in the question. I meant to say Congressman Rowe, which you correctly stated in the answer there, and I appreciate that. Congressman Steve Scalise, Chairman of the Republican Study Committee, thanks so much for being with us today. A pleasure talking with you as always.
Thank you. Great to be with you.
And thanks for watching Newsmax TV.
Great, thank you.